as you determine if you want to try for a VBAC, an important part of this decision is understanding the risks of trying for a VBAC and the potential risks of having a repeat C-section. So with VBACs, the biggest potential risk is the risk of a uterine rupture, of the uterus having a spontaneous tear, and usually at the site where the incision where the previous C-section was performed. And while the chance of this happening is rare, it's like a 0.47% chance for most women, the situation can be really dangerous, and it often requires an emergency C-section, in some cases a blood transfusion, even a hysterectomy for the mom, and oftentimes the baby does need to be admitted to the NICU. And this risk is why it is so important to work with your care provider to determine if you are a good candidate for a VBAC, because a lot of times determining if you are a good candidate for a VBAC, it usually means that you have a fairly low risk of uterine rupture, and you don't have factors that would increase that risk. So that's really the big risk of a VBAC, or the primary risk. Regarding the risk of a potential or of a repeat C-section, there are quite a few. So a C-section increases a woman's risk for hemorrhaging or severe bleeding, blood clots, and bowel obstruction that can be caused by scarring and adhesions from the surgery, potentially severe post-op pain at the site of the incision, and infection through the surgical cuts. And scarring and adhesion tissue, it can make it more likely that women will have, ongoing pelvic pain and potentially a twisted bowel. Women that have a C-section, for the most part, almost always have a longer hospital stay than women that had a vaginal birth. And studies have also found that a woman's risk of the following increases with each C-section that she has. So these risks include emergency surgery to remove the uterus, also called a hysterectomy, placenta previa, which consists of the placenta covering part or all of the opening of the cervix, placenta accretia, which is a really serious condition that consists of the placenta growing into the wall of the uterus, and this can require a hysterectomy in some cases, the surgical removal of the uterus, the need for a blood transfusion, and surgical injury. So for example, the surgeon accidentally cuts the bladder. This is rare, but it can happen. And women also have the risk of having impaired health for about 2 months after birth and difficulty breastfeeding. And speaking of breastfeeding, there are also potential risks for the baby following a C-section. So as I mentioned, in some cases, the babies after C-section have more difficulty breastfeeding. There is an increased risk of breathing problems, less blood flow from the placenta at birth, which could lead to an iron deficiency in the baby, and a higher likelihood of developing certain chronic diseases in childhood, like childhood onset diabetes, childhood obesity, autism spectrum disorder, chronic inflammatory bowel disease, asthma, hay fever, and food sensitivities and allergies. And so with all of that said, if you are not a good candidate for a VBAC and you have a higher risk of a uterine rupture, it could be worth it to assume the risks of a repeat C-section. This is not an incredibly straightforward decision for a lot of women, which is why it is important to make this decision alongside a VBAC supportive care provider, somebody that can help you make a really well-informed decision about which option poses the lowest risk for you and your baby.